This is an excellent drill working on cervical rotation. Now what we're going to do is we're going to give your neck rotation a little bit of an assist or a boost by engaging our postural muscles with a band. Okay, so you're going to take your band and you're going to either use something like this, anchor it where you have two ends. So most people are going to do this at home by anchoring this in the door. They're going to loop it around the backside, they're going to close it into the door frame, and you've got two ends. Okay? Now, I want you to get some good tension. You're going to pull this out, and I want you to lay on your back and get some good tension in the band. Okay? So you want to be far enough away from the door to where you've got solid tension. Now, I'm going to pull my hands to about my chest. My feet are bent, or my knees are bent. First thing I'm going to do, I'm going to make sure that my back is nice and neutral. It's flat on the ground. Okay, I don't want to arch the lumbar spine. I want it to be tilted. I want it to be anchored into the ground. Then I'm going to pick whichever side I want to rotate to. We're going to go both directions. So it doesn't matter which way you start. Let's say we're going to start to the left. Okay, so I'm going to pull this left arm down. So I've pulled it down to the ground here. Now I'm going to do a diagonal pattern. I'm pulling my right to the ground, and I've basically engaged both sides of the postural muscles behind my back, and I'm just going to anchor that to the ground. Okay. Now I'm going to relax my neck, and I'm going to rotate towards the shoulder or the arm that's elevated. Nice and controlled. I want to do this within a comfortable, tolerable range. I'm not trying to push it. Again, I'm leaving my lower back on the ground. I'm not trying to let it arch while my postural muscles are engaged. And I'm going to do 10 rotations to the left. Then I'm going to come up to the top. And then I'm going to do the same thing on the other side. Diagonal pattern, engaging my shoulder blades. I should feel all that come together, right? My shoulder blades should be coming together slightly. I've got tension generated in my spine, and I'm going to rotate to the right. I want to do this 10 times to the right. Once you've hit your 10 mark, you're done, and we're going to do our next exercise without the tension or without the bands. So, give that a shot. Here is the progression to our cervical rotation drill. So in the first exercise, we used our TheraBand to create or engage our postural muscles. So now we're going to take the TheraBand away, and I want you to actually engage that pattern, that diagonal pattern, by yourself and be able to relax the neck enough to rotate it into full cervical rotation. Okay? So you're going to lay on the ground. Again, I want to make sure that my lower back is pressed into the ground. I don't want you to press it, I want you to just roll it, right? I just want it to feel like it's flat, okay? Now, from this position, we're going to start to the left. I'm going to reach, okay? The back of my palm or the back of my hand is going to lay flat on the ground. I don't want any elbow bend. I want to keep my elbow straight, okay? Now, now my right hand is going to go palm down, and I'm actually going, in this position, I want you to be able to generate that tension. So I want you to be able to squeeze your shoulder blades. You're going to lightly push into the ground, both directions, just very lightly, and then I want you rotating 10 times to the left. You should be able to generate a similar postural squeeze in the back without having to use any type of pattern assist with TheraBands. Then we're going to switch. Okay, I'm going up and I'm creating the same kind of squeeze, and then I'm rotating. Good, just letting my head rotate on the ground. So we're going to do 10 to the left, 10 to the right. You can do more of each of these, but I like to start with 10 of each, and then once you get the pattern, once you really have the technique down, you can add more cervical reps. And remember, we're not trying to press the cervical spine into uncomfortable ranges. I'm just trying to take it to the end range tolerably and back to center. All right, now we're going to focus on stability in our neck. So what I mean by that is our neck is generally in this tug of war, right? We've got a lot of powerful muscles in the backside, right? From our upper trap and our levator, and from when we sit like this, a lot of these muscles get tight, they pull our neck backwards, right? Inherently, we're going to have less strength and a lot of weakness in the front side of the neck. And there's a lot of small muscles in the front that are more stability muscles, and they help stabilize. So they get weak, and you get out of balance in terms of that backside to front side stability. Okay, and we tend to get into this type of posture. So what I want to do is give you a way to start working on that deep neck flexion, and you're going to start on your back. It's going to be very simple. Okay, so I'm going to take my chin and I'm going to tuck down. Okay, I don't want to tuck. I'm not trying to tuck as hard as I can where my neck is getting really tight. I just want to tuck it down, and then I'm going to nod up, and I'm going to count 1, 2, 3, back down, and then I'm going to relax. I'm going to tuck, I'm going to nod up. Now maintaining that tuck as I nod up, I'm swiveling my head. I'm not just jamming my head backwards into the ground. So I'm tucking, nodding up. Now start with just the tuck, the nod, right? Then you can add the tuck, and then you can add some time to it to really challenge those stabilizers. Quick, simple exercise. This is something that I like to start on the ground with because you can really feel, it gives you a sense of stability in terms of, okay, I have the floor giving me feedback, and now I know where my tuck is, right? Whereas if I'm standing or sitting, it's like you don't have that same sense of where my head is in space, and so you could actually be here while you're tucking rather than tuck to the appropriate, in the appropriate direction. So doing it with feedback from the ground is great to start, and eventually you can work into more dynamic exercises like the next one. I'm going to give you a more standing, you're still using something for feedback, but you're kind of reworking and re-educating these deep neck flexors to start kicking on during other exercise. Here is an excellent way to work on thoracic mobility, okay? When we're looking at our shoulder and our posture, right, we all kind of tend to be here. So when you look at this, the rounding of our upper back, we need extension in our upper back in order to have full range of motion in our shoulders. If not, it's going to mess with our shoulder blades, and our shoulder blades aren't going to work properly. Neither is our ball and socket or shoulder joint. So I think this is a great way to get the upper back moving again. So we're going to use this foam roller, and I'm going to place this right in between my shoulder blades. All right? It's important that you don't go too high, close to the neck, and vice versa. I don't want people to get too low to where they're on their lower back. Right in between the shoulder blades, there's about a 7 to 8 inch sweet spot of spine, of thoracic spine, that you can really work on. So cradle the neck, and you're going to keep your butt down. You're going to roll the pelvis backwards and wrap your abdominals, contract your abdominals around that. I don't want people to get this big arch in their lower back as they do that. I want you to keep the lower back neutral, and then you're going to extend that upper back over the top of the foam roller, and you're going to rock. So I'm going to work that area out a little bit, and then I can lift my butt. I can roll about 1 inch up or 1 inch down, drop my butt, roll my pelvis back, and now I'm on a whole new segment, and I can work on the mobility there. So it's important you can kind of find areas that are tight, and you can pick and choose kind of where you need to address that thoracic mobility. So I typically do this for a timer. I'll probably set the timer for about 2 to 3 minutes and really work out that thoracic mobility. Here's a mobility drill for your upper back.
for your thoracic spine. Okay, thoracic spine is from here to here, it's kind of your mid-back. So that part of our spine is really built for rotation. And so that's what we're going to emphasize with this drill. I want you to get on your side. A firmer surface is probably a little bit better. I want you to tuck the knees up high. You're going to lock out your lower back when you do that. Okay, so knees tucked up high, try not to have them too low. I'm going to have my bottom arm out, top hand on top of that. Then I'm going to rotate. Okay, now when I rotate, I want to open the chest towards the ceiling. I don't want to just move my shoulder, right? I want to open the chest, really get that rotation through my torso, aiming towards the ceiling. Okay, once I get here, I'm going to hold for a second or two, and then I'm going to rotate back. Now, I like to do this at least 10 to 15 times on each side and really work on that opening in our mid-back.
Okay, so we're going to work on opening or thoracic rotation, and we're going to need a foam roller or a small ball and a band. So I'm going to get into a half kneeling position on the wall. I'm going to pin this foam roller against the wall with my outside leg. I'm going to have my arms straight out in front of me, and as I keep this pinned into the wall, I'm going to actively rotate and turn my chest. Now you're only turning as far as your chest will allow you. If you can get the chest all the way back to the wall, then that's great. But I want you to just turn as far as your chest will allow you. Don't let the shoulder try to go further than it needs to. The shoulder is attached to the chest. We're only worried about chest rotation as we push that foam roller into the wall. Now, if we want to make this a little bit more challenging, I'm going to grab this band and I'm going to get a little width. I'm not going to get hands close together. I'm going to give myself a little space, and I'm going to start here, and I'm going to get a little resistance as I rotate. Remember to keep that foam roller, I let it slip there a little bit, but keep that foam roller pressed as you rotate back. Really helps isolate the thoracic spine, and there's a progression to this exercise. Here's another great drill for thoracic mobility, and now we're going to target both thoracic rotation, but we're also going to have a little lateral flexion to it. So now I'm going to have my inside knee up, and I am going to pin that foam roller to the wall. Okay? So I'm pushing into the wall. Now, I'm going to have my thumb down, and I'm going to open and come back, and I'm trying to go as far back as I can, opening my chest, and then I'm going to come back down. I'm keeping that foam roller pinned into the wall. Coming back down, open, here. So I like to do about 10 to 15 of these on each side. And again, it's all about the chest rotation and less about shoulder rotation than anything. So once I want to make this harder, I'm going to go hands behind my head, and so now my elbow is kind of hitting the side of the wall. And what I'm going to do is I'm going to open and come back down without touching the wall. So I'm getting a little bit of lateral flexion and rotation. Can't touch the wall. I've got to maintain that pressure through the foam roller. Now a lot of people will start to lean into the foam roller. Right? I just want the leg, everything here stays stable, right? As I'm doing this. Okay, so two different drills for rotation and lateral flexion of the thoracic spine. So now we're going to combine a few things. Okay, so we're going to work on our postural stabilizers. So more of your shoulder blades. We're going to get some of your some of the muscles that I think get underutilized within posture. We're going to get those engaged, okay? And then we're also going to stabilize your neck, so you're going to work on both of these dynamic issues with posture in one exercise. So I've got a band. You're going to use the wall as a way to kind of get feedback on your positioning, okay? And I want you to tilt the pelvis backwards, so I'm rolling my low back onto the wall. Okay, I've got a little bit of knee bend and into a small mini squat. Now, I'm going to swivel my chin down. I'm not going to nod my chin down, but I'm going to swivel it here. You don't have to have it on the wall. I just need it to be slightly tucked, swiveled down, just like what we practiced on the ground for our chin tuck. And you're going to engage that tuck. And now I'm going to take this band, and I've got my pelvis locked, I've got my chin locked, and I'm going to engage some of my scapular stabilizers. And I'm going to come out into this W. Don't lose the chin, right? As you engage, you're going to want to break at the chin. So keep that swivel forward, keep that lower back on the wall, and then rep out 12 to 15 of these.